Did you know that the blood pressure target your doctor has been recommending could actually be putting you at serious risk? Recent research from Harvard Medical School reveals something shocking. That magic number of 120/80 that we have all been told to aim for might not be the best target for everyone over 60. In fact, pushing your blood pressure too low could increase your risk of dangerous falls, dizziness, and even cognitive decline. As a physician who has worked with thousands of older adults struggling with blood pressure management, I have seen firsthand how the wrong target can turn a health solution into a health crisis. By the end of this video, you will understand exactly what blood pressure range is safest for your age, and I will give you 5 specific strategies backed by the latest 2025 research to achieve it naturally. Comment below what your current blood pressure reading is and your age. I will be replying to each one. Here is what happens when we talk about blood pressure in older adults. Your blood vessels naturally become stiffer as you age. Think of a brand new garden hose compared to one that has been sitting in the sun for 20 years. The new hose is flexible and adaptable. The old one is rigid and less forgiving. Your arteries work the same way. This stiffening means your heart must work harder to pump blood through your system. According to data from the American Heart Association, over 75% of adults over age 60 have elevated blood pressure readings. That is 3 out of every 4 seniors. The Centers for Disease Control reports that high blood pressure contributes to nearly 500,000 deaths each year in the United States. But here is the shocking part most people do not know. Aggressively lowering blood pressure in older adults can be just as dangerous as leaving it high. Research published in The Lancet in 2024 found that older adults with blood pressure pushed below 110 systolic experienced a 40% higher rate of falls and fainting episodes compared to those maintained at slightly higher levels. Let me tell you about Margaret, a vibrant 72-year-old woman I met 3 years ago. Margaret came to see me after her previous doctor put her on aggressive blood pressure medication to get her reading down to 120/80. She had been feeling terrible for months. Every time she stood up from her chair, the room would spin. She stopped going to her weekly book club because she was terrified of falling. Her daughter had to move in to help with daily activities. Margaret told me through tears that she felt like her independence was slipping away. When I checked her medication regimen, I discovered she was on 3 different blood pressure drugs, pushing her systolic pressure down to 108 on average. We gradually adjusted her medications and allowed her pressure to stabilize around a 135/82. Within 2 weeks, Margaret called me with excitement in her voice. The dizziness was gone. She could stand without feeling faint. Within 6 weeks, she was back at book club and even started taking morning walks again. Today, she is thriving at age 75 with a blood pressure reading that would have made her old doctor panic, but keeps her safe, active, and independent. Here is another story that illustrates this perfectly. Harold, age 68, was obsessed with getting perfect blood pressure numbers. He measured his pressure 4 times a day and panicked whenever it went above 125. His doctor kept adding medications to chase that elusive 120 target. Harold started experiencing severe fatigue, confusion, and twice he collapsed while getting out of bed at night. His wife found him on the bathroom floor both times. When Harold came to me, his blood pressure was averaging 112/70, which sounds great on paper, but his body was not getting enough blood flow to his brain, especially when he stood up. This condition is called orthostatic hypotension. A study from Johns Hopkins in 2020 following 5,000 older adults found that those with systolic blood pressure below 115 had nearly double the risk of falls compared to those maintained between 130 and 140. We adjusted Harold's medications and his target. And his current reading sits comfortably at 138/84. He has had 0 falls in 2 years, his energy returned, and his wife sleeps peacefully knowing he is safe. Now, before we talk about the right target for you, let me share what you absolutely must avoid. These 5 things are silently destroying blood pressure control in seniors, and most doctors never mention them. Comment guilty if you have been doing any of these. Do not worry. You are about to learn how to fix it. Number 5. Too much sodium hidden in unexpected places. You probably know about salt shakers and potato chips, but here is what they do not tell you. The biggest sodium culprits for seniors are foods marketed as healthy. Cottage cheese, canned vegetables labeled low sodium, breakfast cereals, and even whole grain bread can contain shocking amounts of hidden salt. A single serving of some popular whole wheat breads contains 230 milligrams of sodium. Eat 2 slices for breakfast and a sandwich for lunch, and you have consumed over 900 milligrams before dinner. The American Heart Association recommends no more than 1,500 milligrams daily for adults with high blood pressure. Research from the Mayo Clinic published in 2023 found that seniors who reduced sodium intake by just 400 milligrams per day experienced an average blood pressure drop of 6 points systolic within 3 weeks. But here is the shocking part most people do not know. Excess sodium does not just raise your blood pressure temporarily, it fundamentally changes how your kidneys handle fluid balance. Your body holds onto extra water to dilute the sodium, which increases blood volume. More volume means more pressure against artery walls. Over time, this damages the delicate lining of your blood vessels, creating inflammation and making them even stiffer. Number 4. Sitting too long without movement. Do you know what happens when you sit for more than 30 minutes without moving? Your blood vessels begin to constrict. Blood flow to your legs decreases by up to 50%. Your body releases stress hormones that raise blood pressure. A groundbreaking study from the University of Western Australia in 2024 tracked 400 adults aged 65 to 80. Those who sat for more than 6 hours daily had blood pressure readings averaging 11 points higher than those who broke up sitting time with short movement breaks. The researchers found that simply standing up and walking around the room for 2 minutes every 30 minutes lowered systolic pressure by an average of 8 points over 8 weeks. Traditional Chinese medicine has recognized this for thousands of years. Ancient practitioners taught that stagnation in the body creates disease. Modern science now proves this wisdom. When you sit, blood pools in your lower extremities. Your heart must work harder to circulate that pooled blood. This creates sustained pressure spikes throughout the day that add up to chronic elevation. Number 3, chronic dehydration that nobody talks about. This is one of the most misunderstood factors in blood pressure control. Many seniors deliberately drink less water because they worry about frequent bathroom trips or nighttime urination, but here is the hidden disaster. When you are dehydrated, your blood becomes thicker and more concentrated. Your body releases a hormone called vasopressin, which constricts blood vessels to maintain pressure. This combination dramatically increases the workload on your heart. Research from Loma Linda University in 2022 showed that older adults who drank less than 4 glasses of water daily had systolic blood pressure readings averaging 12 points higher than those who drank 6 to 8 glasses. The study followed 300 participants aged 62 to 84 over 6 months. But here is what makes this especially dangerous for seniors. As we age, our natural thirst mechanism becomes less sensitive. You might be significantly dehydrated without ever feeling thirsty. Your kidneys also become less efficient at concentrating urine, meaning you need more water to maintain the same hydration level you had at age 40. Number 2, unmanaged stress and poor sleep quality. Do you know what happens to your blood pressure when you do not sleep well? Within hours of a poor night of sleep, your body enters a state of heightened stress. Cortisol levels spike. Your sympathetic nervous system stays activated. Blood vessels remain constricted. This is not just about feeling tired. A landmark study published in the Journal of the American College of Cardiology in 2023 followed 2,400 adults over age 60 for 4 years. Those who regularly slept less than 6 hours per night had a 37% higher risk of developing treatment-resistant hypertension compared to those who slept 7 to 8 hours. The mechanism is fascinating and frightening. During deep sleep, your blood pressure naturally drops by 10 to 20%. This nightly dip gives your cardiovascular system essential recovery time. When sleep is disrupted, you lose this protective dip. Your heart and blood vessels never get to rest. Over months and years, this sustained stress remodels your entire cardiovascular system, making vessels stiffer and less responsive to normal regulatory signals. Number 1, medication timing that works against your body. This is the mistake I see most often, and it is completely preventable. Most people take all their blood pressure medications first thing in the morning with breakfast. This seems logical, right? But here is what research reveals. Your blood pressure naturally follows a circadian rhythm. For most people, pressure is lowest during sleep, rises sharply upon waking, peaks in late morning, dips slightly after lunch, peaks again in early evening, then falls during the night. A revolutionary study from the University of Vigo in Spain, published in 2025, randomized 8,500 adults with hypertension to take medications either upon waking or before bed. Those who took medications at bedtime experienced a 45% lower rate of heart attacks and strokes over 6 years compared to the morning group. The same dosage, the same medications, but dramatically different outcomes based purely on timing. Before I reveal the number 1 strategy to optimize your blood pressure naturally, which of these 5 surprised you most? Comment below. Now, let me share the 5 most powerful strategies to achieve healthy blood pressure for your age. These are presented in countdown format because I want to build to the most important and effective approach. Number 5, strategic potassium from whole food sources. Do you know what happens when you eat a potassium-rich food like a banana or sweet potato? Within 30 minutes, potassium begins entering your bloodstream. This mineral has an extraordinary effect on your blood vessels. It helps your body excrete excess sodium through urine. It relaxes the walls of your blood vessels, allowing them to dilate and expand. This reduces the pressure of blood flowing through your system. Research from Harvard Medical School, published in 2024, followed 4,700 adults aged 60 to 85 who increased dietary potassium intake. The study found that consuming 3,500 to 4,000 milligrams of potassium daily from food sources lowered systolic blood pressure by an average of 7 points and diastolic pressure by 4 points over 12 weeks. The participants did not change medications or make any other dietary modifications. Traditional Asian medicine has used potassium-rich herbs and foods for centuries to treat what they called ascending liver yang, which manifests as symptoms we now recognize as high blood pressure. Here's exactly how to apply this. Aim for 3,500 milligrams of potassium daily from whole foods. 1 medium sweet potato provides 540 milligrams. 1 cup of cooked spinach gives you 840 milligrams. 1 medium banana contains 420 milligrams. A cup of white beans provides 1,000 milligrams. 1 medium avocado delivers 690 milligrams. You can easily reach your target by including 2 to 3 of these foods daily. Most seniors notice a measurable blood pressure reduction within 2 weeks. The full effect builds over 8 to 12 weeks. Number 4. Magnesium from leafy greens and nuts. Do you know what happens when you consume magnesium-rich foods? This mineral works differently than potassium, but the effect on blood pressure is equally powerful. Magnesium acts as a natural calcium channel blocker. It prevents excessive calcium from entering your heart and blood vessel cells. When calcium floods into these cells, they contract forcefully, raising blood pressure. Magnesium provides the opposing signal, allowing cells to relax and vessels to stay dilated. A meta-analysis published in the American Journal of Clinical Nutrition in 2023 examined 34 studies involving over 15,000 participants. The research found that supplementing with 350 to 400 milligrams of magnesium daily reduced systolic blood pressure by an average of 4.3 points and diastolic by 2.7 points. But getting magnesium from food provides even better results because you also consume beneficial fiber and phytonutrients. Here is your practical application strategy. Aim for 400 to 420 milligrams of magnesium daily for men, 310 to 320 for women. 1 cup of cooked spinach provides 157 milligrams. 1 ounce of almonds gives you 80 milligrams. 1 cup of black beans contains 120 milligrams. Half a cup of cooked quinoa provides 60 milligrams. 1 ounce of dark chocolate delivers 65 milligrams. Include magnesium-rich foods at lunch and dinner. You should notice improved blood pressure control within 3 to 4 weeks. Many people also report better sleep quality, which further supports blood pressure management. Number 3, daily movement with strategic timing. Do you know what happens inside your body during moderate intensity walking? Within the first 5 minutes, your heart rate increases and blood starts flowing more vigorously through your vessels. This increased flow stimulates your blood vessel lining to release nitric oxide, a powerful compound that causes vessels to relax and expand. The effect lasts for hours after exercise ends. The STEP trial from China, published in the New England Journal of Medicine in 2021, studied 8,511 adults aged 60 to 80 with hypertension. One group received intensive blood pressure treatment targeting below 130 systolic. The control group targeted below 140. But here is what made the study remarkable. Both groups were counseled on daily movement. Those who walked 30 minutes daily, 5 days per week, experienced the same blood pressure reduction as adding an extra medication. The study showed a 26% reduction in major cardiovascular events over 4 years. Here is your specific application protocol. Walk for 30 minutes at a pace where you can talk but not sing. Do this 5 days per week. The ideal timing is late afternoon or early evening when blood pressure naturally peaks for most people. This perfectly counteracts the daily surge. Break your walk into 2 15-minute sessions if needed. Research shows the blood pressure benefit is the same whether you walk continuously or in shorter bouts. Within 1 week, you will notice lower afternoon readings. The full cardiovascular remodeling that sustains lower pressure develops over 8 to 12 weeks of consistent practice. Number 2, the DASH eating pattern with senior modifications. Do you know what happens when you follow the dietary approaches to stop hypertension plan? This eating pattern was specifically designed by the National Institutes of Health to lower blood pressure without medication. The diet emphasizes vegetables, fruits, whole grains, lean proteins, and low-fat dairy while limiting sodium, red meat, and added sugars. A landmark study from Johns Hopkins in 2022 followed 480 adults over age 65 who adopted the DASH eating plan. After 8 weeks, average systolic blood pressure dropped by 11 points. After 6 months, the reduction was sustained at 10 points. This is equivalent to taking 2 blood pressure medications. The study found the effect was even more pronounced in adults over 70, with average reductions of 14 points systolic. Here's exactly how to implement this. Fill half your plate with vegetables and fruits at every meal. Choose whole grains like oatmeal, brown rice, and whole wheat bread instead of refined grains. Include a serving of low-fat dairy such as yogurt or milk twice daily for calcium. Eat fish or poultry instead of red meat 4 to 5 times per week. Limit sodium to 2,500 milligrams per day. Add nuts, seeds, and legumes for healthy fats and fiber. Most people notice measurable blood pressure reduction within 2 weeks. The full benefit develops over 2 to 3 months as your body responds to consistent nutrient intake. Number 1, personalized blood pressure targets based on your functional status. This is the game changer that most doctors still do not understand. Recent research from multiple institutions, including Harvard, Johns Hopkins, and the Mayo Clinic, confirms what I have been seeing in clinical practice for years. The ideal blood pressure target for older adults depends on your individual health status, not your age alone. The 2025 American Heart Association guidelines now acknowledge this critical distinction. For robust, healthy seniors without significant chronic disease, a target of 130 over 80 is appropriate and safe. This aligns with findings from the SPRINT trial, which showed a 27% reduction in death from all causes when targeting systolic below 120 in relatively healthy older adults. However, for seniors with multiple chronic conditions, frequent falls, cognitive impairment, or frailty, a more moderate target of 140/90 or even 150/90 is safer and more appropriate. Research published in the Journal of the American Medical Association in 2024 found that frail older adults treated to aggressive blood pressure targets below a 130 systolic experienced 40% more falls, 35% more hospitalizations for injuries, and 28% faster cognitive decline compared to those maintained at a 140 to 150 systolic. Here is what this means practically. If you are over 65 and active, independent, walk without assistance, have no major chronic diseases, and your doctor agrees, targeting 130/80 is reasonable. If you are over 75 or have any of the following conditions, a target of 140/90 is more appropriate. These conditions include history of falls, dizziness upon standing, use of a cane or walker, mild cognitive impairment, chronic kidney disease, or you take more than 5 medications daily. The key is working with a physician who understands this individualized approach and monitors not just your numbers, but your functional status, fall risk, and quality of life. Here is what makes these 5 strategies work even better together. When you combine potassium-rich foods, magnesium sources, daily movement, the DASH eating pattern, and personalized targets, the effects multiply. A practical example for breakfast might include oatmeal topped with sliced banana and almonds, plus a cup of low-fat yogurt. This single meal provides potassium, magnesium, whole grains, and calcium. For lunch, try a large salad with mixed greens, grilled chicken, white beans, and olive oil dressing with a sweet potato on the side. This combination delivers protein, fiber, potassium, and healthy fats. For dinner, consider baked salmon with roasted Brussels sprouts and quinoa. This provides omega-3 fatty acids, magnesium, fiber, and complete protein. Each meal supports blood pressure control through multiple mechanisms working synergistically. Now, I need to share some important warnings. If you are currently taking blood pressure medication, never stop or reduce it without medical supervision. Making dietary changes while on medication can cause your pressure to drop too low, leading to dangerous falls and fainting. Always work with your healthcare provider to adjust medications as your lifestyle changes take effect. If you experience severe dizziness, chest pain, severe headache, or vision changes, seek immediate medical attention. These could indicate dangerously high blood pressure or other serious conditions. If you take potassium-sparing diuretics or have chronic kidney disease, do not increase potassium intake without consulting your doctor. Excess potassium can be dangerous with these conditions. Always consult your healthcare provider before making significant changes to your diet or exercise routine. You now have the knowledge that most seniors never discover. The blood pressure target that keeps you healthy and active might be different from what you have been told. You do not have to accept dizziness, falls, or loss of independence as inevitable. This is in your control. The research is clear. Personalized blood pressure management based on your functional status, combined with potassium-rich foods, magnesium sources, daily movement, and DASH eating patterns, gives you the power to maintain cardiovascular health while preserving quality of life. Comment one of 3 things below. Number 1, I am going to adjust my blood pressure target with my doctor. Number 2, I am starting the DASH diet tomorrow. Number 3, I will walk 30 minutes 5 days this week. If you found this video helpful, subscribe to this channel where I break down the latest senior health research into strategies you can actually use. Next week, I am revealing why the common thyroid medication most seniors take could be weakening their bones, and what to do about it. You will not want to miss it. If this video helped you understand blood pressure management better, share it with someone who needs this information. You might save their life.